Hello. My hello to all of you. All of you watching me on YouTube live. My hello to all of you. So this is FMGE Recall Psychiatry Questions Discussion, recently conducted exam. 6 questions were there with respect to psychiatry. First question, as per the recall, which of the following is not suggestive of a medical cause of mental illness? Come on. Not suggestive of medical cause. Mental illness can be medical cause present or medical cause absent. If medical cause is present, we call it as organic, and if medical cause is absent, we call it as functional. So organic example, your dementia, delirium, etc. Functional example, your schizophrenia, depression, etc. So they are asking you how to differentiate functional from organic. Elderly is more towards organic, acute onset more towards organic, loss of consciousness more towards organic, and auditory hallucination more towards functional. This chart is given in your concept book also, and in most of the psychiatric books, how to differentiate organic versus functional. Organic means cause present, functional means cause absent. Acute onset is more towards chronic, acute onset is more toward organic, gradual onset is more toward functional. Acute is organic is more in old age, dementia, delirium. It is more towards young age. Consciousness is impaired, example delirium, consciousness is preserved. Now this point is very important. Visual hallucination are more towards organic, and auditory hallucination are more towards functional. Neurological deficit is present, maybe absent. Delirium, dementia is towards organic. Schizophrenia, bipolar are more towards functional. Keep this chart in mind. Next question. A 27-year-old female having bipolar disorder was on lithium. Was this question doable for you? Come on. Answer me in comments. Was this question doable for you? Which of the following statement is incorrect? Hemodialysis is not used. No. Hemodialysis is the treatment of lithium toxicity. Lithium decreases thyroid function. Yes. Hypothyroidism is a known complication of lithium. Thiazide increase lithium toxicity. Yes. They decrease lithium clearance. Hence, they increase the serum level of lithium. Hence, they increase toxicity. It is avoided in pregnancy due to its teratogenic effect of Epstein anomaly. So the answer is A. I repeat, hemodialysis is used. Lithium known to cause hypothyroidism. Thiazide decrease lithium clearance, hence increase serum lithium level and hence increase toxicity. Lithium has known teratogenicity known as Epstein's anomaly. On MSc here stands for mental status examination. Patient is asked to subtract 7 from 100. Which does it assess? The best answer here is concentration. Actually, it is a test of attention and concentration. Attention can be drawn and concentration can be sustained. So there was some confusion among answering as attention or concentration. Okay, serial 100 minus 7, the test is both attention and concentration. But concentration is a better answer than attention. Have a look at Kaplan textbook of psychiatry synopsis. Alertness, orientation, concentration. Starting at 100, count backward by 7. So in Kaplan it is given under concentration. Attention can be drawn, concentration can be sustained. This is how we say. On testing for attention and concentration, attention can be drawn and concentration was full sustained, well sustained, ill sustained. Common effect of cannabis or marijuana intake. Depression is seen in cannabis withdrawal. Physical dependence is seen but not common. Anxiety is again seen in cannabis withdrawal. A state of dreaminess with altered consciousness. Cannabis may cause a dreamlike state, altered perceptions it may cause. Cannabis can cause increased perception. It can cause flashbacks, where it can cause decreased appreciation of time. At very high doses, it can lead to delirium. Cannabis can cause depersonalization like state, as a phenomenon, and detach from self. Cannabis can cause panic reaction like state. Cannabis has a lot of psychological effect, dream-like state, altered consciousness, conjunctival injection. Depression and anxiety are also seen with cannabis, but they are more likely in withdrawal. Physical dependence is seen, but not very likely. State of dreaminess with altered consciousness is the best answer here. Now a clinical question. A 25-year-old male patient present with complaint. Aliens are communicating with him. Aliens are communicating. They are sending an electromagnetic radiation to his brain. Aliens are asking him to kill his distant relatives. Aliens are asking him to kill his distant relatives. This is command auditory hallucination. Second person. Diseases for last 20 years. Stop going in social function. So it is hallucination plus more than 6 month duration plus social impairment, which is towards the diagnosis of schizophrenia. It does not have any low mood, no anhedonia. It does not have any elevated mood, no increased energy. Okay, delusional disorder, there is no social impairment and only delusions, no hallucinations. So this is more towards the diagnosis of schizophrenia. Schizophrenia has delusion, hallucination, disorganized speech, disorganized behavior, negative symptoms, 2 out of 5 for a period of 6 months. At least 1 out of the 3 must be this, and in this case we have hallucination, 6 months, social impairment. This makes toward the diagnosis of schizophrenia. Okay, auditory hallucination commanding the patient, first rank symptom, duration more than 6 months, and social impairment. Last question. Man was taking medicine for depression but had sexual dysfunction. Which drug would you switch him on to address his problem? Answer should be propion. Escitalopram causes very high sexual dysfunction in the form of anorgasmia, delayed orgasm, TCA also causes sexual dysfunction. Venlafaxine also causes. Answer is bupropion. Among antidepressant, bupropion and mirtazapine. Mirtazapine was asked in INICET 2020. Mirtazapine and bupropion cause least sexual dysfunction, and bupropion is NDRI, norepinephrine dopamine reuptake inhibitor, which increases sexual desire. So the answer is bupropion. That's all about this particular paper discussion. If you have any queries, please get back to me. Thank you.